Well, we all know about how serious breast cancer can be, but often people don't understand it until it affects you directly. Eyewitness News reporter Jeremy Baker shows us how some are working to change that. Jeremy?
Yeah, Deborah, Breast Cancer Symposium is taking place downtown this week, and it's extremely personal for many of those presenting.
For me, as a core military guy, you don't turn down the opportunity for some, fresh perspective and intelligence in your field.
Robin Bale and Nick Alexander are working with their team at a company called Seno to develop opto-acoustic ultrasound technology. It marries lasers and ultrasound for a new kind of imaging, a faster way to determine if a tumor is malignant or benign, ultimately cutting down on the number of biopsies needed. But the company wanted to put a face to the technology by introducing them to breast cancer survivors like Jennifer Comely and Rosita Vargas and hearing their journeys.
To really kind of make that personal connection to the patient, I wanted to be able to speak to someone who this device would directly affect, and the idea is to improve their lives, their treatment journey.
There's another element added when you can hear the fear in the person's voice.
The very first time was the scariest was in 1995.
Rosita Vargas diagnosed with breast cancer 2 more times over the next 20 years.
Many times it's on your mind, it's stressful, not knowing what's going to come out, is it going to be okay?
Anxiety, waiting for results. You go through a series of tests to make sure that that's what it is.
Jennifer Comely was diagnosed with breast cancer at the age of 35.
I found a lump accidentally.
1 year later was diagnosed again with stage 4.
My type of breast cancer, thankfully, is one of the most aggressive, but there's been a lot of research and medications for that just recently.
Both women say this groundbreaking program to inform others about the disease, in a sense, has been an emotional lifeline.
There aren't many companies that reach out that way, the way this program is, to see exactly how you felt.
When they make it personal, it affects not only myself, my whole family. And even though I don't see them crying in the corner, they are.
Personal program at Seno was initially a pilot project, but now it's being rolled out across the company to help all employees keep the patient at the center of the heart of every activity in the company. Jeremy Baker, KENS5, Eyewitness News.